Did you know that your right to healthcare is supposed to be universal and absolute? That means everyone, every single person, should have access to all necessary medical services. But what if I told you that this right is being limited, step by step, through laws and regulations that most people don't even notice? Let's break this down. Under Article 12 of the ICESCR, which Canada has agreed to follow, the government is required to ensure the highest attainable standard of physical and mental health. It specifically says that conditions must be created to assure all medical services and medical attention for everyone in times of sickness. Notice the word all. It's universal, without exception. Now, here's where it gets tricky. In Canada, healthcare is governed by both federal and provincial laws. At the federal level, terms like resident are defined in a way that recognizes you as a natural person, a human being with inherent rights. Sounds good so far, right? But when we look at provincial healthcare laws, like in Ontario, things start to change. The term resident now shifts to a corporate or statutory framework. It ties your identity to being incorporated into a municipality. You're no longer just a person, you're a statutory entity. Why does that matter? Because this shift allows the government to define and limit who qualifies for healthcare. And here's another twist. Instead of guaranteeing access to all medical services, provincial laws limit you to prescribed services. What does prescribed mean? It means only the services listed in regulations. So, instead of having a universal right to healthcare, you're only entitled to what's on their list. That's not what the ICESCR promised. By doing this, they've turned your absolute right into a conditional privilege. They've created barriers through definitions and regulations, effectively controlling who gets what. And if you think this is just an accident, think again. The preamble of these laws actually says it's not the intention of the government to impair rights. But actions speak louder than words. The way these laws are written shows intent. They've structured the system to look compliant on the surface, while quietly limiting your rights in practice. So, what can we do about it? The first step is awareness. Understand that your rights are being systematically limited through legal frameworks. Know that under international law, your right to healthcare isn't something that can be narrowed down to prescribed services. It's absolute. Remember these 3 points. Your right to healthcare is universal and guaranteed under international law. Provincial laws are limiting this right by turning all services into prescribed services. Definitions like resident are being used to control access to these rights. This isn't just about legal terms, it's about your health and your rights. Share this video, start a conversation, and let's make sure everyone understands what's at stake. Together, we can hold the system accountable. Your rights matter. Learn more at eternallyaware.com.